Hello, welcome to the Co-Production Campaigning and the Independence of Parent Carer Forums webinar. This is a Contact National Network of Parent Carer Forums webinar, and it's presented by Mrunal Sisodia, who's the co-chair of the National Network, and Kate Hurn, who's the Operations Lead for Parent Participation Programme for Contact. Okay, so yes, lovely. So shall we begin?
Yeah. So this is Kate talking from Contact. I'm the ops operational lead and lead for the Northwest at Contact, and as Sue's already said, I'll be co-delivering with Mrunal. So this webinar aims really to support forums to consider how they might want to work with campaign groups and the types of things they'd need to consider when thinking about that. And so it's quite helpful to start with some definitions really about campaigning and co-production. The important thing here is that they are both really meaningful and effective tools to create change for families with disabled children. So the Charity Commission's definition of campaigning is that the Commission uses the word to refer to awareness raising and to educate or involve the public by mobilising their support on a particular issue or to influence or change public attitudes. And it also uses it to refer to campaign activity which aims to ensure that existing laws are observed. Obviously, the bread and butter of forums and the NNPCF and the participation work at Contact is all about co-production. And many of you will know very well that that's all about creating an equal and reciprocal partnership where everyone's experience, knowledge and skills are used to create better outcomes. So just starting with the two definitions there really, and a bit more of an overview now from Mrunal.
Okay, thank you, Kate and Sue. So good afternoon, everybody. I'm Mrunal Sisodia. I'm one of the co-chairs of the National Network of Parent Carer Forums. So some of you may have seen this presentation before. It's based upon a workshop that we held at last year's conference, which seems a long time ago. But essentially, it goes through 7 different aspects of campaigning and co-production. And the idea being that it builds to hopefully give you a very clear picture of what forums should and should not be doing, and how we can walk that tightrope really between the world of campaigning and co-production, because the differentiation isn't always clear and it is always a challenge, especially in the context that we have at the moment, where there's a lot of activity going on from campaign groups in the SEND world, and they are struggling to understand our role, and we equally well are struggling to articulate clearly what our role is in regard to the work that we're all doing to move the SEND agenda forward. So the first of those elements that we want to talk about is total honesty. So I think there's something here around parent carer forums having the confidence to be honest. We are all, first and foremost, we're all parents and carers of children and young people with SEND, and that's, regardless of anything else we do, I would posit that our most important role is as a mum or as a dad. And that means that we have a really strong obligation to our children to be trying to represent what their lives are really, really like. And we should be very solidly grounded within our communities. And there's a strong element here of being willing and able to tell truth to power. And so, to be absolutely clear, this does include things such as challenging, criticizing, being constructive whilst you're doing it, providing evidence and holding to account, which I think that historically we have been sometimes reluctant to do. But to be absolutely clear, for the last few years, the Parent Carer Forum movement, I think, has had the confidence and the capacity to actually do this. And I think this really is based upon the maxim that says you're only going to change the world if you're really, really brutally honest about where you are. There's no point pretending that we're in Glasgow when we're actually in Pennsylvania if we're trying to travel to New York. So what is the role of parent carer forums? Well, at the NNPCF, we actually have this very simple 4-point model of what we try and do. And this really works for us, and I'd encourage you to adopt it if it works for you. we do 4 things at the NNPCF. We listen, so we listen to the lived experience of families. We then translate all of that lived experience into what does this mean when it comes to creating policy, changing commissioning, how services are delivered. What are the big themes that we're hearing? The next thing that we do is we represent those views to the people that make decisions, that commission services, deliver services, and create law and policy. And that really is the heart of co-production, that third bullet there. And then the last thing we do, which is really, really important, and I'll talk a little bit more about later, is feedback to our families. So in order to do this, we need to be really, really clear about how we listen. How do we listen? How do we know that we are really representing the views of families? And there's a variety of means that we use. There's meetings, events, there's a lot of forums, including the NNPCF, do member surveys. There's consultations and calls for evidence. There's our very active social media platforms. There's one-to-one conversations, and I honestly believe there's nothing that can beat a one-to-one conversation with family members, with our members, because that's where you really learn what's going on. Your own conferences, and let's not forget that we're all parent carers, so it's our own lives. So we've got to listen to our own experiences as much as those of everybody else. Feedback. We're not very good at feeding back. Now, to unpick that a little bit, some of the reasons that we hear around why we don't feed back very well to our families is, the most common one is we're just so busy doing the work ourselves. We also don't like to blow our own trumpet. We don't like to brag about what we're doing. I think we're a very modest group of people. Forums sometimes only communicate when there's something is finished and they feel there's something to communicate. And too often we communicate about the process rather than the outcome and the impact. So we will say things such as, we attended 15 meetings last month. What I'd like to suggest is that actually, what the key thing we need to be communicating is what are we saying about our lives? What representations are we making about the lives of families? And I think the real benefit of that is then people will see that we are talking about the same things that they are talking about, that the campaign groups are talking about, and that are affecting and impacting their own lived lives. So whilst it's really good to talk, to communicate as much as you can and feedback as much as you can, what our members really, really want to hear is what we're saying on their behalf. So please, please, please share with them the representations that you are making on a daily basis when you're having the conversations with decision makers. Moving on to the next next item of the 7 that we're going to talk about is the memorandum of understanding that we have between the local authority, the Parent Carer Forum, and the Department for Education. There are some really important points in this MOU which really preserve and bake into stone the 4 key principles you see at the bottom there, those being co-production, the independence of parent carer forums, respect for one another, and honesty. We actually thought long and hard about this MOU, and it was adapted in 2019 following a lot of feedback that we got. So myself and Gail Walsh actually sat down and went through a lot of the feedback and a lot of the challenges that forums were facing, and we added the following text to the MOU. So to be absolutely crystal clear, this text bakes into the relationships both the independence of the Parent Carer Forum, their role in raising concerns and representing needs and holding to account, and criticising and working together as equal and respected partners. And this MOU cuts both ways. So if you do get any challenges from groups that say you're not independent, that you're funded by the DFE or you're funded by the local authority, just point them to the MOU, because it actually preserves and makes very explicit the independence of parent carer forums, and the fact that we can criticise constructively and we do and should hold to account, and we should raise issues. And within that, I think that there's something that we need to brag about a little bit, which is that within this system, parent carer forums have a unique role. Nobody else can do what we do because we're embedded in the code of practice. Other parent groups aren't. We also do the real work that makes the system better. So parent carer forums on a daily basis are involved in things such as reviewing and rewriting policies and literature and communications to parents. We do sit on panels, we do sit on decision-making boards. And I think that's a unique position. There's also other guidance that explicitly requires local authorities to work with PCF. So things such as some funding around additional schools capital, the local area inspections guides, transport consultations. PCFs are slowly being written into and baked into further guidance apart from the code of practice. And there are other opportunities to embed the work that PCFs do into the system. And I think this is really, really important for us, because I think that whilst there's a lot of groups out there that will tell people what is wrong with the system, our USP, our unique selling point, is really that we're the ones that will sit down and we'll tell you what's wrong with the system, but we'll also sit down and we'll tell you how it should be improved, what needs to change to make it better, above and beyond more money. And these 2 points are really, really important for us, which is that we are truly representative in the sense that we are pan disability and we are 0 to 25. And we actually actively work to reach people outside of social media, and we have a lot of face-to-face contact, which is really important to many sections of our community who are not so PC literate. And we're the only group that really engages at the start of the conversation, in the middle of the conversation, and at the end of the conversation to really follow through that things are better as they should be.
Now, just a quick question from somebody just asking what MOU stands for. If you could just clarify that, please.
MOU stands for, we had it on the slide up there, it's Memorandum of Understanding. And it's the basis of the contractual relationship between the Department for Education, local authorities, and parent carer forums. So keeping going, the next slide is about relationships, because creating change is all about relationships. We need to make sure that we build strong relationships, because frankly, if you don't have the relationships, people aren't going to listen to you, and they're not going to change anything about the way they're doing. And there's some really simple rules, because it can be very difficult building these sorts of relationships, given that you are telling people things sometimes they don't want to hear, and sometimes you have to be quite, if I'm going to use the language, you have to be quite robust about what you're telling people and how you're telling them that stuff, because sometimes they don't want to listen to what you're telling them. And here's some simple rules about building those relationships with your partners in local authorities and CCGs or providers, whoever it might be, and also frankly with other groups, other parent groups as well, which is don't say anything in public that you haven't already said in private. So don't take to social media to make statements that you wouldn't say to somebody face to face and you haven't already said to somebody face to face. It's really important that you do share what you're doing publicly, but don't start there. Be respectful. I think we all understand that one, that actually people don't tend, I for one, I don't listen to people who shout at me. And I don't see why I should expect anybody else to listen to me if I shout at them. Be factual. This is something that's really important. I think that sometimes it's important to take the emotion out of the conversation and try to bring evidence to the conversation. And that evidence doesn't have to be statistics or fact in that regard. What it has to be is it can be anecdotes, but it must be really strongly based in the lived experience that families are telling you. And the key rule is no surprises. Nobody likes to be taken by surprise. Make sure that everybody you work with knows where you're coming from and what you're going to be talking about. And the golden rule here is that, you know, when we talk to local authorities, when we talk to campaign groups, when we talk to CCGs and providers, we have an expectation of how we would like them to treat us. We've got to make sure we model that behaviour.
So we're going to move on to some government guidance there. So in 2016, there were limitations on the use of government funds for campaign activity, and this was written into government contracts, not just the DFE grant for forums. Funds from non-governmental contracts are not subject to the same restrictions. And so it does mean that in those conditions of grant for forums, it does say that the grant can't be used for campaigning or lobbying purposes. But forums really need to decide whether a particular campaign activity is compatible with their ethos of co-production, and consider a number of circumstances and issues to consider whether they want to support or work with a campaign. The limitations on the funding don't stop forums working with campaign groups, and as we've already said earlier, sharing an outcome with a group that engages in campaign activities could mean that there's an opportunity there for the forum to work together to create change.
And there's been a lot said about the fact that the contract is what I keep talking about, says that forums can't campaign. And I think it's really important that we clarify this point, that actually the language in the contracts came from a change in government policy in 2016 that has been interpreted and characterized by some elements as gagging clauses. They are not gagging clauses. To be actually very, very clear, they are not gagging clauses. And the whole of the voluntary sector took this up with the government very explicitly, sort of saying this is a real block, this is causing real confusion for us around our ability to articulate the challenges and the issues that the sectors of the community we represent are facing. And there was a letter, there was the NCVO wrote to government, and there was a letter from the then Prime Minister, Theresa May. Okay, she's no longer Prime Minister, but it comes from the Prime Minister's office, so this still holds. That's out there. There's a link to the letter there that you can look at, and these slides will be distributed. That makes it very, very clear that these are not gagging clauses. The providers, providers, including parent carer forums, can fairly criticise, and they do not stop charities from campaigning for a particular cause, or would never be used as a means of attempting to stifle legitimate debate. So I think that the interpretation of the 2016 contractual obligations has gone too far, and the government has now very clearly rowed back from that. That our independence and freedom of speech are protected, and we do have a role in raising issues and being critical where it is fair. So moving on explicitly to campaign groups, I think that there is no restriction at all on working with campaign groups. You can and should liaise with local campaign groups and national campaign groups where their aims and objectives align with what you want to achieve. But within that, I think you've got to be very, very clear about what you can and can't do, and what constitutes real campaigning, pure campaigning activity. Because there are some things that campaign groups can do that parent carer forums can't do. And that's really beneficial, because working with them, it gives you access to get messages out using some of these methods that parent carer forums find a little bit more challenging. So things such as organising protests and petitions, using the courts, actually taking local authorities, local areas to court, which parent carer forums are not really in a position to do, and media campaigns. And we do have guidance on this, which I think is in the process of being updated and will be on the website either later today or tomorrow, So please take a look at that around how we might work with campaign groups. At this point, I'm going to try and do something technical again, so bear with me. I'm going to try and launch a video of what one parent carer forum, HPCI Hertfordshire, did when they were working with a campaign group. So Kate, if I just hand over to you for a moment or two whilst I try to get this video going.
Yeah. So Carol, the coordinator there, has worked with us on a video to talk about how they worked with the Nascot Lawn Campaign, which is quite high profile. So there it is. So thank you, Carol, if you're on, for helping us with this.
Hi, Carol. Thank you so much for agreeing to speak about how your forum, Hertfordshire Parent Carer Involvement, worked with parents and with other groups around the proposed closure of Nascot Lawn Respite Facility. Now, I know this was a really high-profile campaign. Can you tell me how the forum first got involved?
Yes, so it started back in June 2017. Actually, it was started during Carers Week, ironically. We've got 2 CCGs, and one of them wrote to all the parents who were attending their overnight respite unit, tell them that they were proposing to close it. They also announced that to the local authority at the same time, and it was the first that either of us have heard of it. So it immediately obviously caused huge stress and anxiety for those families. And neither the forum nor the parents using it had been consulted about this possibility. And immediately there were worries about the impact on those families and how their needs would be met in the future, and also about consultation with other strategic partners and what the impact might be on the other services as a result of the closure.
Right, and these were families of children with complex healthcare needs, weren't they?
Yeah.
So what did the forum do?
So the first thing that we did was identify 2 parent reps who could work on this, and so we could have some continuity, but also because we live in quite a large county, they've been needed to travel, so they wouldn't always be able to reach the venue easily from home. We kept our membership informed, and we also knew that we had parents on our network who would be affected directly. And 2 of them had roles as reps. So they quickly formed a campaign group and an action group. And so we were able to work well with them because we already had contacts within the campaign group. But we didn't let those parents who are running the campaign group be the reps. We had separate parent reps to the campaign group, the reps within the campaign group. So we made sure that parents on our network more widely knew about the campaign group and knew what was going on. So that was and kept within our rules of giving out information, but not necessarily hurrahing saying you've got to get involved with this. And we worked with the local authority closely about having wider consultation, making sure that we had parent reps at all of the meetings that were going on so that we could represent families in person at the time in that wider strategic way that we do. And we also made sure that we kept up with communications to our network about what was going on at various stages, because it took over a year for the whole thing to conclude. And communication, not too much. You have to balance those communications against communications about other things you're putting out, because you need to be careful when you're looking at one particular need group that isn't dominating everything that the forum's doing.
Right. And can I ask you, what difference did you? I'm sorry. Can we stop here? It's this one. What were the main challenges of working in this way?
It very quickly became a high-profile case. So it had a high profile locally in newspapers. It was also featured on the BBC and was frequently in the press. It was in national press as well as local press. And 2 JRs were actually actioned as well. so it became complicated on the legal case side as well. So helping parents understand what the different procedures were and what processes that things had to go through, so that we could direct energies in the most useful way. Obviously, it affected the capacity of the forum, plus gave us the challenge that we needed to carry on with everything else we were doing at the same time, and making sure that we weren't seen to be over representing one group, one need group above another. And we had to work with a big range of partners and groups, and some that we hadn't really worked with before, perhaps health partners who we hadn't worked alongside didn't really know about the forum. So those were some of the main challenges. And I think also it can be quite draining and emotionally and physically for the parent reps that are closely involved in it, because it was very emotive, because these children were particularly vulnerable, and the profile. So we had to be careful about the exposure of those reps.
And what do you think, what difference did it make having the forum involved in communicating about the campaign?
I think it helped for us to have a more slightly removed, more strategic voice that wasn't quite so emotional. A lot of the messages were naturally, because that's what you do when you're publicising emotional messages, and ours were tended to be more on a, okay, so what are the actual implications of this for different partners? How's this going to work for families? What's going to happen? And so that's how we sort of focused in. It also actually helped us identify that there was some gaps in provision, particularly around the younger children that were attending the respite unit. It became aware that actually we needed to look at those early years again, because it seemed that the local authority wasn't picking up some of those children as early as it should have done, because they were being catered for over in health, and the communication wasn't working. So that was more of a long-term thing that we're still working on, like most of areas on joint working. It actually helped promote the forum in a strange way. So as a result of it, we now have termly meetings with our Director of Children's Services and key assistant directors, because they saw how we operated during the whole process and then wanted to keep up that close contact. And we also highlighted really that these children existed to counsellors as well, because their work is usually dominated by adult services, and many of them were not aware that children like this were out there in their communities. Right. And we were able to look at other issues that it brought up in other services and get those considered, and perhaps facilitate the discussions between different partners. And also it raised our profile with health. So subsequent to that, we had more engagement with health providers, and that's continued to this day.
Right. So ultimately the decision was made to close the centre, but were there, you've mentioned a few of them already, were there any other sort of positive outcomes that came out of working with the strategic partners and also working with the campaign group?
I think we've worked successfully alongside the campaign group. We were clear with explaining to them why we couldn't actively campaign with them, and we were also clear to our network about why we couldn't do that. And that's helped us to develop our campaigning statement that we have on our website, or that we might put out intermittently when we need to, about how we go about things. So we're emphasising that we've got the same aims, but we go about it in a slightly different way, and that can work well together. And also meeting directly with counsellors has meant that longer term there's more awareness of the forum, and more awareness of SEND, a lot more awareness of SEND amongst counsellors generally as a result of it. We were also able to provide evidence for the scrutiny for counsellors, and also that was used then in the court cases to support the action that the families were bringing, and brought the NHS providers and CCGs more to the table in terms of parent care involvement than they had been before. So there have been some longer term, and certainly for the overnight short breaks that the local authority provide, it's actually expanded the range of skills and knowledge and who the children they're able to provide an overnight short break for as a result of the closure of Nascot. And I think although that was under discussion, it moved much more quickly than it perhaps would have done otherwise, and has made got health. So we've got an agreement, we've got Section 75 over the funding. So it's made health aware that actually they can't walk away from their responsibilities for short breaks, and that clarified that they actually have one. And so, you know, proper agreements have been put in place as a result, and that pattern is probably going to be replicated as we go on with other services, making sure you've got that, rather than it perhaps being simply on a trust and a handshake type model.
Yeah. So it's almost formalised some of those agreements with all the other statutory agencies to work in a different way together, and given you a more powerful voice, and people know more about what you do as a result of it.
Yes.
That's really interesting.
And I think since then, obviously that was back in 2017, 2018, we've had other campaign groups nationally and locally arise, and that's helped us work with the local authority to talk to those groups, and for the local authorities taking the view that the forum is the way that families need to come in with their issues. They will talk to them, but we're the formal route for them to go through. And so we've worked alongside them with other campaign groups since then.
Right. Oh, that's absolutely fascinating, Carol, and it's really good to hear that that's really, you know, strengthened your role as the strategic partner of the local authority and the CCGs and the collective voice of parent carers. Thank you so much. I know you mentioned one of the resources that the statement that you put on your website, and I know you did some other resources around explaining your role to practitioners and everything. And maybe if people are interested in getting those, maybe they could contact parent.participation@contact.org.uk, and we can make those available if people want to see those, if that would be all right.
Yes, lovely, no problem.
All right, thank you.
My screen again.
Yeah, we're just moving to the next
So
slide.
there's just a couple of questions came up during that, if I may. So the first one was, could we clarify if the forum advertised the campaign, the protest, via social media? So I can answer that yes, that they absolutely did. They told people that the campaign was going on, how they could find out more about it, how, you know, what some of the main findings were. So yes, they did do that. And the other one was asking if we could just clarify that the use of the word campaigning, e.g. a campaign to raise awareness of a disability, is not the same as campaigning. So like a media campaign being a different activity to campaigning. So
yes, I think when we talk about campaigning, I mean, you know, the word can be interpreted in different ways, but I think what we're meaning, which was on one of Mrunal's slides earlier, you know, is around protest, petition, using the courts, and it doesn't, as you said before, it doesn't stop a forum from sharing a petition if the petition is in line with their aims. They can share that. It's just that they wouldn't be the originator of the protest. They wouldn't be using the conditions of grant to create the petition itself. Mrunal, I don't know if you wanted to add to that at all.
No, I think that's exactly right. So information sharing, raising awareness, is all explicitly within the scope of parent care reforms. There's no problem with it. It's just that when you start to move into what are actively protest type activities is where I think that we need to be a little bit more careful. So really just to unpick and perhaps to emphasize some of the key points in that that Carol made in that video about how we should go about working with campaign groups. So the first thing is really is going back to the feedback point that we mentioned earlier. You know, we should tell people what we are saying in meetings with decision makers. We should have no reservations about being honest and open about what representations we are making. But within that, we all know that there are some things, sometimes parent carer forums are brought into people's confidence, and we are told things we are not in a position to share. And most people understand that. Most people understand that some things, you know, you occasionally, as individuals and as an organisation, we are sometimes told things in confidence. And it is fine to say that there are some things that you've been told in confidence and you're not able to share at this moment in time. But I think that the key message is that actually, because we are so rooted in our communities, because we are living the lives ourselves, what we're doing is we'll be saying the same things that the campaign groups are saying typically. We'll be articulating the same issues and the same problems. And the fact that we are being honest about that, and that we are working with groups to find a way forward, we should not be ashamed of. I think that it's really fine for parent carer forums to gather evidence and to share the impact of planned changes, or why a particular issue is important. So whilst we may not get together a position, for example, the example that we've got here is changes to school transport policies. Whilst we may not organise a petition that says, you know, don't change the school transport policy, what we can and absolutely must do is do a survey of our members and say that actually we have identified 52 children that will spend an extra 30 minutes on the bus as a result of these changes. There's no problem with that. There's a bullet here that explicitly answers the question that was asked a moment ago, which was, you know, please do share campaign group information, making sure you're sharing information to the extent that the objectives of the campaign group align with the objectives of the parent carer forum. There's nothing to stop you having a coffee or a glass of wine or a beer with the organisers of the campaign groups and have a little chat with them and compare notes about what's working, what's not working, who they might.
Don't use your grant to fund the alcohol.
And discuss whether legal training on the campaign topic would be useful as well.
Just to say as well, when you are sharing, if you are sharing petitions or something that aligns with your aims, obviously if it doesn't align with your aims, there's no obligation to work together on that specific topic, but it's being transparent about how you explain that. And if you're sharing something that you support, perhaps you can share the petition, but say how the forum is endeavouring to work in co-production at the same time on that matter, because it does give your partners an opportunity then to continue to work with the forum over an issue that they might also be facing a campaign on. Mrunal, had you finished what you wanted to say on the previous slide? Yeah, oh brilliant. So the next slide is just a little bit about Contact. Us here at Contact campaigns and how we work together with forums. So obviously as a national charity working for families with children with SEND, we campaign, but we also, a heavy part of our work is also parent participation, and we administer that Department for Education contract to forums. So we are definitely, part of us is working very, very carefully to try and achieve change through parent participation and co-productive working. You know, with forums, with the NNPCF and with our other close partners, the Council for Disabled Children and Kids. But as a national charity, we also influence policy and campaigns. So politicians and decision makers tackle the inequalities faced by families with disabled children. And there's some examples there on that slide. Our campaigns are completely strengthened by our partnerships with forums and with the NNPCF. They provide evidence and experiences from local parent care forums, which really do strengthen any influence and any campaigning that we can do. And the conversations help us with conversations with MPs, officials and journalists. So we are a team really, and although we're using different methods at different times, and there are some rules surrounding the grant funding around campaigning, the bottom line really is that, you know, a win for children with SEND and their families is a win for all of us, and we will use the different methods available to make that happen. And forums and the NNPCF have always been phenomenal in supporting that. Contact also runs the Disabled Children's Partnership, which you may already be aware of. We've put the link in there if not, so please take a look.
Right, and these are some of the challenges that forums get around from campaign groups. So you don't represent me, you're in the local authority's pocket, whose side are you on? And rather bizarrely, you're only in it for the money. And I often joke that yes, everybody in the parent carer forum world is just in it for the money. If only that were true. And over the last few years, I think, particularly when it comes to the NNPCF, we've really managed to stop a lot of this criticism. And we've done it by doing a lot of the things that we've talked about in this webinar. The first is being really, really open about how we are listening, and we show that we are listening and that we are representing the views that we are hearing, so that we are genuinely representative. We're not making it up, and being very, very clear about what we are saying every time we meet with a minister or an official or an NHS commissioner. And that transparency, that actual openness about the fact that we are listening and that we are representing what we have heard, actually cuts off a lot of the criticism, because people then understand that actually we're saying the same sorts of things that they would be if they were in the room. And what's really interesting sometimes is when we have had the continued challenge, sometimes steering group members or myself as co-chair have just contacted some of our biggest critics and had a word with them and asked them the question, so if you've looked at our website and you've seen this is what we're hearing and this is what we're saying, what is it that you would say in addition to that? What is it that we are not saying that you would be? And that's often a very interesting conversation, because sometimes you learn something that would be beneficial. Sometimes they do have an angle that is actually genuinely useful and instructive and helps our work. And a lot of the time, they don't have an answer. So either way, it's actually a really helpful conversation to have. So don't be afraid of actually going and asking that question. Back to you, Kate.
Yeah, thank you. So personal activity comes up more and more these days with social media and the pressures that are among and happening to forums and the individuals trying to run forums. There is nothing to stop any member of a parent care forum engaging in campaign activities as an individual. There's so much going on out there. This is not something that contact or the funding stops people from doing. But it is really important, especially in these times, to be aware of perceptions and that not everyone will understand the difference between personal and forum activity. So it is important to be careful to separate those two things, because things can be seen as being done on behalf of the forum when perhaps they are not being done on behalf of the forum. And having a clear line between those two things is important, especially when you're working closely in your community and you know people and you're building up relationships. That clarity, it becomes more important. There are certain things that can help you with this when you're running a forum, reviewing your forum's code of conduct and conflicts of interest policy, potentially social media policy as well. And I guess if a situation arises that you're unsure about, it's about sharing that as a steering group, getting advice from your contact advisor if you need it. But yes, taking it to the steering group and discussing if required. But that's nothing to stop, certainly nothing to stop an individual campaigning if they want to. In terms of forum governance, there are no hard and fast rules, and forums have different legal structures as to how they're run and who they may be accountable to in other terms. So you may have another regulator, so you may be bound by, well, you will be bound if you're a forum by the conditions of grant for the Department for Education funding, but you may well also need to ask other regulators advice or seek their advice depending on if you're a charity or another structure. You'd need to assess and manage each situation individually, which I think I've already said, and make sure you stay true to your own forum's governance documentation and way of working. The constitution, articles, strategy, values and ethos all need to be taken into account. If you're getting funding from other work streams and you're considering campaign activity, you'd need to look at the requirements within that funding as well. And as I say, consider any other regulators that maybe you're accountable to, depending on your legal structure.
And just to build on that, I think that there's a lot that we've spoken about today, which is really around sort of governance and legal structures and what the law says and what what the conditions of grant are and what the government says subsequent to that. But I think one of the two most important bullets in this presentation are the last two on this slide, which is about values and ethos. Which is, if we remember what we're about, who we're here for, who we're really here for, and what we're trying to achieve and how we're trying to achieve it, be true to our values and our ethos as individuals and as parent-led groups that want to make things better. I think that's, we won't go far wrong. If we do the right things and we do them for the right reasons, we won't go far wrong within the framework that we've outlined today. And it's really on that sort of note.
Sorry to interrupt you, but I was just going to say the other thing that you mentioned around values and ethos that's really important was the confidence point you mentioned at the beginning, and that you can always come to us and we'll talk through situations with you, of course, but having that confidence to work and take the action that you want to with your values and ethos underpinning that. We can always advise you on the conditions of grant, but you are independent organisations, and you will you'll have your own ideas when these situations start coming up, and it's about going back to that core as to what you're about and having the confidence to do that. And so I think that's a really good point that Mrunal mentioned earlier as well.
Okay, and just to end on this, this is a minefield. Let's be clear that it is not easy. And I love this quote from JFK, which is, we do this and other things not because they are easy, but because they are hard. And there's no problem at all with us, doing the hard things, because we get up every day as parent carers of children, young people with SEND, and we do the hard things every day. But I think that, let's keep doing them. Let's keep working at it, because it's doing this stuff that actually makes a difference. It's doing the hard stuff that actually makes a difference, because most of the things that are worth doing are hard. And I certainly believe that helping young children like my son is definitely worthwhile. And I'm willing to take a little bit of complexity and a little bit of a heartache to get that right.
Yeah. And so, just to end on a happy note, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I think that's quite poignant at the moment, considering how much, how hard it is with capacity and how hard it is to keep the forums going and make the difference you want to in a national pandemic. So just to remember that one at the end there.
Okay, well, I'd just like to thank Kate and Mrunal for that presentation, and we are getting a few more questions coming in. I'm just reading them live. So as a KIC, we're not allowed to campaign. Now the national network is a KIC. Can forums who do campaign be part of the national network, or will that conflict with the national network's KIC status? I don't know if you can answer that, Mrunal.
No, there's no conflict at all. I think that there are very particular provisos around what you can and cannot do as a charity and as a CIC, and you as a individual organisation must stay within those requirements for your own particular regulator, because the Charities Commission has a broad brush definition of what charities can and can't do, and equally well the Office of the CIC regulator also has some specifics. So as long as you stay within that, there is no issue at all.
Okay, I'll just wait and see if any more questions come in, but just to remind people that there will be a short questionnaire that comes up at the end of the webinar. Please do fill that in, because it really helps us to design new training that you might need, and to answer any questions that you've thought of after the webinar that we can answer and put up on the website on our resources page. And also just to say, we'll be putting up some documents to do with the Nascot Lawn Campaign, some of the things that they shared with their members during the time. So we'll hope that you'll find those useful too. Just had another one saying, thank you, it's a very tricky area. It is.
Thank you. Just to say, Mrunal touched on this earlier as well. We have updated our guidance on campaigns, and we will be emailing forums and popping that on our website very, very shortly, just to make the guidance a bit clearer. But it still comes down to considering the individual situation, as I'm sure you can imagine.
Yeah. So it doesn't look like, and there's a lot of information that's been covered today, it doesn't look like there's any other questions coming in. If you do have questions, as I say, you know, do put them forward to your advisor, and we will make sure that they're put next to the webinar, which will be on our resources page, and then all the other documents. Just people saying it's been helpful. So I think we'll wrap it up there then. Thank you so much, Kate and Mrunal, for going through that, and thank you also to Carol Kelsey for telling us about the campaign. That was really, working with the campaign group was really interesting too. So thank you, everybody.
Thank you for joining us. Thank you. Bye bye.